Hi, students. Welcome. Thanks for joining us to learn a little bit more about the profession of medical assistant. With me today from the Greater Altoona Career and Technology Center is Mrs. Jamie Zurenko. She's our medical assistant and medical office specialist program coordinator and faculty in both those programs, as well as phlebotomy and a few other areas. So Jamie, thanks for joining us today.
Thanks for having me today.
So we're going to ask Jamie a few questions so that myself and the students watching this will get to learn more about the profession of a medical assistant. So Jamie, how did you decide to enter the profession, not only as a medical assistant, but now also as an educator?
Well, I decided to become a medical assistant because I like to help people, and I was interested in the medical field and felt that medical assisting was a very versatile profession. So when I was working in an office for many years, I just felt like I needed something different and saw an opportunity to teach it. And ever since I did that, I just really enjoyed it. I feel it's very rewarding to share my experiences with the students.
Now, Jamie, have you always worked in the healthcare field?
Yes, I always have. I went to school right out of high school to become a medical assistant, and I've been working in the field ever since.
Now, speaking of high school, Jamie, what kind of experiences or subjects should our students be taking while they're in high school that would be helpful to someone thinking about a career in healthcare in general, or also as a medical assistant specifically?
I think health and biology classes would be helpful, as would anatomy and physiology if it's offered. I know some schools do offer it and some don't. Some have future health service clubs or something with the same kind of title that may benefit students looking into a career in the health field.
And what do you enjoy most about your job?
I enjoy helping the students reach their goals and becoming successful in their chosen field, whichever, if it's medical office or medical assistant, where they can do both.
And when you were a medical assistant, what did you like most about that?
Um, I, I really like the patient interaction. You can, especially if you work like in a family practice, you really can create good bonds with some of the patients.
And what do you feel is the projected need for new employees in the healthcare field and specifically as medical assistants?
I feel the need is very high for workers in healthcare, and especially for medical assistants. An MA is very valuable in the office because they're taught both administrative and clinical skills. And job growth for a medical assistant is expected to grow more than 20% in the next 10 years.
Wow, that's great. That's a great statistic for our students to know as they're thinking about next steps after high school. And tell us about where medical assistants can work.
They can work in clinics, offices, hospitals, labs doing phlebotomy. Some work in dental offices, and a medical assistant is a very versatile career.
Great. Well, thank you, Jamie, so much for taking some time to join us today. Students, we hope you found this helpful, and you can learn more about our medical assistant program on our website, and stop by if you want to visit and see our medical assistants students in action. So thank you.
Thank you.